歡迎。
Welcome to the media briefing today. The speakers today are Dr. Albert Au, Principal Medical and Health Officer of the CHP, and Dr. Lau Kah-Hin, Chief Manager of the Hospital Authority. The doctors will tell us about the latest updates as well as the exchange situation. Dr. Au, please. Good afternoon, members of the public and media friends. I now report to you the new cases recorded yesterday on the 2nd of July. Yesterday, for locally infected cases, there were 1,681, among which 437 were confirmed by PCR test. The other 1,244 cases were tested positive on RAT and confirmed via PCR test. And also, we had 147 imported cases, among which 106 were confirmed via PCR test and 41 via RAT. So far, in the fifth wave, we have recorded 1,239,539 positive cases. Yesterday, there were no new deaths. So far, in the fifth wave, Hong Kong has recorded 9,192 deaths. Now, Dr. Lau, please tell us about the HA situation. Good afternoon. At present, we have 761 patients receiving in-hospital treatment with 79 new patients. Among those who require to check into isolation facility, 255 are in isolation ward, and 19 are in Tier 2 secondary isolation ward. 249 patients are at the North Lantau Hong Kong Infection Control Center with 62 new patients. Yesterday, there was one new critical patient and 3 serious patients. Among the inpatients, 11 are in critical conditions and 13 are serious. 2 critical patients are in ICU. In the past 24 hours, there were no patients, COVID patients who passed away. Back to Dr. Albert Au. Thank you. Now on the latest situation yesterday, among the 147 imported cases, 80 were caught as the temporary specimen collection center at the airport, and 58 were identified positive during hotel quarantine, and the remaining 9 were tested positive after the 7th day in the community. On the 1st and 2nd of July, 4 residential care homes have reported new infections, including 2 elderly care homes and 2 care homes for people with disabilities, involving 4 residents and 1 staff member. On the 1st of July, there were 2 residential care homes reporting infection. The first one is in Tuen Mun, that is a Yu Yi Zhi Jia, a care home for PWD. 1 resident was tested positive. The onset was the 1st of July, and he was tested positive on the same day. He has received 2 doses. He went out on the 27th of June. 14 residents in the same care home are classified as close contacts. The second one is the Christian Family Service Center Charity Foundation Ging Lim elderly care home in Sai Kung. 1 resident came down with COVID. The resident has 1 dose of vaccination with no symptom, tested positive on the 29th of June, and 9 residents are also close contacts. Yesterday, there were 2 new residential care homes with new infection. The first, the Shan Xin Jia Se in Kwun Tong. 1 resident on the 5th floor has tested positive. The onset was the 2nd of July, and he was tested positive on the same days. He has received 2 doses. He went out on the 28th of June. In the same care home, 1 staff member also came down with COVID. The carer last worked on the 1st of July and tested positive on the 2nd, and onset was on the 3rd. The carer has had 3 doses. The carer has cared for the infected patient. So 7 residents and 3 staff members are close contacts. The last one is the Yen Ngoi Wu Lu Yuan first branch in Tsuen Wan. 1 resident is infected with no vaccination and no symptoms. On the 2nd of July, the resident was tested positive on RAT. The residents went out on the 29th of June, and 6 other residents are also classified as close contacts. And About the residential care home, that is the Yuan Yuan care home for the elderly people in Tsuen Wan, which we reported on the 1st of July. There are new updates. On the 3rd of July, 3 residents on a floor tested positive, so 9 residents have been classified as close contacts and isolated. Yesterday, there was 1 resident on the same floor tested positive, as well as another carer. They both had 3 doses. To be safe, the 30 residents on the same floor have been arranged to undergo quarantine. Now, today is school holiday, so we don't have any new cases from schools. So between the 27th of June and the 30th of June, we have received 1,073 reports from schools. Compared with the previous week, that was 1,112. The number is similar. So among the cases, 899 were students. On average, every day there were 710,000 students undergoing RET. The positive rate is 0.13%, and 174 cases were teaching staff. So on average, last week there were 114,000 teaching staff undergoing RET every day. So the positive rate was 0.15% last week. So comparing with the entire population, there were 11,000 positive rates. So territory-wise, the population positive rate was 0.15%. Concerning BA.5 and 0.4 and 0.5 cases, we have found 2 cases in the same class in the same school. That is Yuan Long Jiu Le Shou Memorial School, class 5A. The first case is a 17-year-old male student with 2 doses. Genome sequencing shows that he is a BA.2.12.1 case. He lives in Park Yoho, Block 25A. The onset was the 25th, and he last went to school on the 24th. The entire family, with 5 family members, all came down with the illness. In the same class, there is a 16-year-old male student with no vaccination. He lives in Yuan Long, and the onset was the 28th. He last attended school on the same day and also tested positive on the same day via RAT. To be careful, we advise the class to suspend in-person class. And some updates about previous clusters. First, the hotspot Fudi, we have seen 3 new cases, all patients. One, they are patrons at the same table with previous patients. So far, there are 14 patients. There are 14 patients with a BA.5 or 0.4, and the onset date was between the 26th of June and the 1st of July. So on the night of concern, there were some 108 patients. The positive rate was about 13%. All 19 staff members were tested negative. And among the 14 cases, the family members of 1 case are tested positive. And also there is 1 case which is probably a case which is reinfected. That is a 32-year-old male with 1 dose. On the 5th of March, he was tested positive on RAT. And again, he had an onset on the 30th of June and was tested positive on RAT on the 1st of July. And we have arranged a PCR confirmation test for him. The day before yesterday, we collected 10 environmental samples from the restaurants, all negative. They include samples from the vents, doorknobs, table, chairs, and also cubicle partition boards. And all samples came back negative. In terms of genome sequencing, in the past 2 days, the laboratory of the CHP has found 23 suspected BA.2.12.1 cases, including close contacts or cases with epidemiological link. 20 cases are untraceable so far. 2 cases are linked with the 20 cases, including 1 family member and 1 close contact. And also, a case is related to another case announced earlier on. The case lives at Kinman House, Oyman Estate. With the building has seen infection before, and now we have seen a second unit with infection.
In terms of BA4, BA5, yesterday there were 28 suspected cases, of which 25 are locally acquired with no known source of infection, and there are 3 related to imported cases. For the locally acquired cases, at least 10 are untraceable, 11 are related to these 10 untraceable cases. They've dined together, they're close contacts. They're living in Sha Tin Hiu Chui Sanzhong Block 10, Gu Nong Lao, Block F. There are 2 cases in the household, and there are 2 people visiting this household testing positive. Also, Taipo, One Fok Estate, One Ho Court, Home Antin Sigmund House, Zhengguano, Waking One Bun, Block 12. There are 3 cases. Kwai Chong, Kwai Lun Estate, Kwai Hei House, 2 cases. Ma On Shan, Kam Ying Court, Block A, Kam Leung Court, Zhengguano, Dong Gong Sing, Block 3. There are 3 cases. Waking Garden in Cheng Yi. And the last case is Tuen Bun Siulun Court, Block E, Soilun Court. Now, in this case, his co-worker is also positive, and there are 2 family members testing positive, and there are household members testing positive also. These 2 cases are working as ground staff on the apron. They're working for Jardine Aviation Services Group. For the first case, who lives in Tuen Bun, a 23-year-old male. On June 22nd, he developed some mild symptoms. On June 24th, he tested PCR negative. On 29th, he tested RAT positive. Together with another colleague, on June 24th, he had dinner together. And this colleague is a 29-year-old male. He developed symptoms on the 29th of June. Now, these 2 people are working in the restricted area in the airport, and it is likely that they got in touch with the air crew members. They may be related to imported cases, but still awaiting the genome sequencing. There are 4 cases that are epidemiological linked with earlier cases. The one in Choi Yip Ting in Yunlong, a student, and Ma On Shan, Kam Ying Court, Block K, Kam Yi Court. There is a household with 3 cases. Now, for this block, there is another floor facing the same direction. There was another case. There are 3 cases related to imported cases. The source is a 50-year-old female student. On June 21st, she came back from Canada, and she had she left the quarantine hotel on the 28th, and she went to a relative's place for dinner. She actually lives at Yongok-do, Man King Fong, and she tested positive on the 29th, and her family member also tested positive on the 28th. She went to Tai Gu Shing, visiting a relative in Gumting Mansion. And there are 2 cases there. Now, for these 3 cases, they are related to imported cases. For locally acquired BA4, BA5 cases, the number stands at 102. 19 of them are related to quarantine hotels, airport, and close relatives. And 10 are related to imported cases. There are 73 that don't have any known source of infection, and they are related to some of the family members. There are 30 where we cannot trace any source of infection. Dr. Lau. Over the past day, 4 more patients have recovered, and 39 have been discharged. Since the 5th wave, 52,121 patients have recovered, and 51,791 have been discharged. And We have 64,501 patients who have recovered and 64,171 who have been discharged. There were 2 patients picked up during admission screening. There are 3 patients listed as close contacts. For staff members, 24,436 have come down with COVID, and 24,102 have already been back to their posts. And there is a report regarding the Castle Peak Hospital, the psychiatric ward. There is one patient assistant who came down with COVID. There are 3 patients, or 3 patient assistants, and 1 patient who tested positive. The relevant patients and assistants have been isolated for treatment in stable condition, and the ward has been disinfected. The hospital will be monitoring the state of health of the patients and the staff members, and they will be maintaining close communication with the CHP. Right. Time for questions. Please identify the organization you represent. A lady in red. TVB. Now, there are some guests attending the celebration on July 1st who came down with COVID, like it was Stephen Ho and Mr. Tam Yu-jong. Are there any people who are listed as close contacts, and how many are they? And are you worried that there is a cluster arising from this celebration? And do you think that there are silent carriers that are spreading the virus? Would you advise that everyone who participated in the celebration event to stay at home to monitor their health condition? Well, in general, when we report positive cases, we will follow up and conduct epidemiological investigation for close contacts. They include the family members in the household, and also during the incubation period, that's 2 days before the onset. If there are contacts without face mask on, they will be regarded as close contacts. But generally, this is the practice. Next, please. Now TV. Now there are 2 hotels that have been turned into a closed-loop hotel. They are not quarantine hotels, and there are occupants who tested positive. And what is the ventilation like? Has it got anything to do with the transmission? And the hotels are reopened, and they are taking in occupants. How do you think that they can make sure that people will not get infected? When we identify positive cases, or whether they are living in quarantine hotel or other hotels, we would notify the hotels and get them to conduct thorough cleansing and disinfection. Next, please. English question, please.
Hi, a few questions from the SCMP. As lawmaker Stephen Ho, who took a group picture with President Xi on June 30th, was tested positive today, is there any flaw with the closed-loop arrangement and any infection risk for President Xi? And Stephen Ho also attended a parade by the fisheries sector on June 28th. Is the CHP aware of any possible outbreaks in the sector? Thank you.
As mentioned, usually for classification of close contact during contact tracing, we will classify persons who had face-to-face direct contact with another person without mask as close contacts, as well as their household contacts.
下一題。
Next, please. A lady over there, please. Cable news. This question is about Mr. Stephen Ho, electrical member. What sort of activities did he attend on June 30th? The people he got into contact with, should they be tested? And is it likely there is a cluster outbreak. The number today is a bit lower. It is 1,600 today versus 2,000 previous days. Because of the typhoon and all the labs were closed, are you worried that the number will be creeping up in the following days?
And following up on some cases, now at the Castle Peak Hospital, a patient assistant is confirmed as well. So have you conducted genome sequencing? Does she belong to the same cluster? Now about the hotspot foodie in Kwun Tong, have you investigated the ventilation, the air exchange rate? Is there any breach of regulation? Thank you for your questions. Your first question was about the Legislative Council member. So we have conducted epidemiological investigation. Normally for family members and close contacts who have face-to-face contacts without mask during the infectious period, they would be classified as close contacts. Concerning the infection number confirmed via RAT or PCR, the number today is about 1,200. I mean, the cases are confirmed by PCR. So this, the number is similar with a previous level. Today, we have fewer cases confirmed via PCR. We believe that it is because of the typhoon. Many people have been staying home. And during most of the daytime, the testing centers are closed. So we believe that the reduced number today is because of the fewer tests performed yesterday. The testing centers have resumed service yesterday night, so we believe that it would be reflected in the number tomorrow and day after tomorrow. And also some people have conducted RAT. So we have arranged for the contractors to go to the patients and take the samples for confirmation. So concerning the hotpot restaurants, we have visited the premises with the FEHD and the EMSD. And the FEHD consider that the restaurant has not been in breach of CAP 599F. So we have taken environmental sample from the vents, and the sample came back negative. The MSD has calculated the air exchange rate, and the rate is 7.3 per hour, so it is up to standard. What about the Castle Peak assistant? So for the psychiatric ward of the Castle Peak Hospital, 1 patient and 3 service assistants are confirmed with the illness. The infection control team has visited the ward and investigate the links between the patients, and the samples have been sent for analysis to find out the root of infection. We will try to find out the source. Most importantly, the ward has been thoroughly disinfected, and it stopped receiving new patients or discharge. All hospital staff are being tested to confirm they are free of the virus. The gentleman over there. Good afternoon, doctors. I'm from Bing Pao Daily. Concerning the reunification, the celebration, a electrical member has been infected. There are state leaders, including President Xi, at the ceremony. So have you contacted the counterparts in the mainland, and how do they see the risk? Concerning BA.4 and .5 strains, the CHP said that most of the cases are BA.5 and they are not from a single origin. So how many sources we are talking about when you conduct the genome sequencing? And about the Kwun Tong hotpot foodie, BA.2.12.1 was spread wide via the McDonald cluster. Now you said that most cases from the hotpot cluster are BA.5 or 0.4 cases. So is it likely that it will lead to an outbreak of BA.4 and 0.5 in the community? So you said there was a secondary infection case. So is that the first time we have seen such cases for BA.4 and 0.5? And concerning the Yuen Long Secondary School, which class is it? And what about the family members' situation? Are they all carriers of the subvariants? Thank you. Concerning the infection control arrangements concerning the reunification ceremony, before the ceremony, we have been in close liaison with the mainland counterparts, so I have nothing to add. Concerning the genome sequencing for BA.4 and 0.5 variants, as the Public Services Laboratory, we would perform preliminary analysis for all positive samples at the position 4, 5, and 2. If it is an AL, then it means that it is the prevailing BA.2 strain. For if they are the other locations, it would mean that they are at BA.2, 0.12.1, or BA.4 and 0.5. After that, we would perform a whole genome sequencing to find out the exact variant. So like I said, for locally infected cases, we have found one BA.4 case, or specifically BA.4.1. The patient lives at Shun Tin Estate. He works as a cabin cleaner at the airport. The other cases are subvariants under a BA.5 strain, including BA.5, BA.5.1, or BA.5.2.1, and BA.5.2, BA.5.3.1. So the genome sequences for these cases are not similar. It shows that among the BA.5 cases in the community, there are several sources, but not a single origin, unlike a BA.2, 0.12.1. At the initial stage, the strain spread via the McDonald cluster. So it seems that we have several different sources for BA.5. So we will do precise genome sequencing to see if the gene sequences are identical. We have found some similar sequences, but in terms of the epidemiological links, we have found none, and there are no overlapping of the locations where the patients have visited. So we believe that there are several origins causing silent transmission in the community. That's why we have some untraceable cases. We will keep closely monitoring the situation, and every day we would see whether we have new BA.4 and 0.5 cases, and we would perform epidemiological investigation and analysis. And we will also calculate the ratio in the total number of cases to see whether there is a rising trend. At present, among the 1,000 or 2,000 cases, we would only find a score of BA.4, 0.5 cases. But we may see more cases under these strains. Concerning the hotpot cluster, we have found no epidemiological links between the cluster and the other cases, except for the family member of a diner. So we will keep closely monitoring whether there will be a secondary or third generation infection. Concerning the Yuen Long Secondary School, like I said, the class is class 5A. The gentleman over there. Good afternoon. I'm from AM 730. Concerning Shanzhen Jia Se, the care home, is there any link between this care home and the previous cluster? Concerning BA.4 and 0.5, we have seen more cases among airport workers. So is it inevitable that they come down with the subvariant? Is it because of the characteristic of the strains, it is more easily to catch them. Does it mean that the silent transmission of BA.4 and 0.5 have supersede that of BA.2, 0.12, 0.1? And also because of the typhoon, has it slowed down the isolation or quarantine arrangement? And will it cause a risk? Is the reduced number today a reflection of the typhoon? And has the rebound caused by the long holiday been offset by the typhoon? And also in the coming few days, will the number reflect the backlog?
Thank you for your question. The first question is about Shaanxi Gaze, this rehab center. This is a new outbreak. There is nothing to do with the previous Shenzhen Gaze. That one is over and done with, and all the positive cases have been isolated and recovered, and the close contacts have also been quarantined. They have returned to the center. There are different hostels. There are 3 different centers, and this one is on the 5th floor, the Shaanxi Gaze. The staff members and the residents would not be going to the 4th floor or the Shenzhen Gaze, the one that experienced an outbreak earlier. But there are some residents who may pop to the 7th floor workshop for work. We haven't identified on the 4th and 6th floor there are any cases. And on the 5th floor, there are cases involving the staff members and the residents. We will keep an eye on this. For these care home, they have to give the residents RAT tests every day, and the staff members will also have to undergo RAT test. For the other staff members and residents, they are classified as close contacts and they have to be quarantined. The second question is about those working at airport and at a quarantine hotel, and versus BA4, BA5. Now, these are high-risk places. The CHP and other departments do give guidelines to these people. They have to don the PPE, and at work they have to follow the relevant protocol, which will guard against any infection. Now, for Omicron, in particular BA4, BA5, they are highly transmissible. It would be rather hard to avoid any exposure at work. They are getting in touch with high-risk group or any travelers, and they are liable to be infected. Now, for those who are working in these high-risk places, they have to be subject to regular testing. And this is terribly important because if cases occur, they can be picked up soon enough in order to guard against any further transmission in the community. The third question about the typhoon period and the arrangement. Now, we do conduct epidemiological investigation. Now, for the RAT cases that are submitted, and also for the PCR cases declared, they would receive the isolation order as an SMS, either home quarantine or quarantine at facilities. If the home environment is not suited for quarantine, we will issue the isolation order. Yesterday, because of the onslaught of typhoon, maybe there were some impacts, but post-typhoon, we should be able to catch up with the situation. For CTNs, the testing centers were suspended yesterday, and later on today, the department will be issuing the CTNs that would cover the CTN that should have been covered in the past 2 days. Yes, indeed. The community testing facilities, some of them were or have suspended the operations, and the PCR numbers or the testing numbers certainly would be lower, and these are reflected in today's numbers. that we have 437 cases of PCR positives. Previously, normally we have around about 600 or so. This is way down, but with services resuming, I'm sure that the results will be reflected in the next couple of days. Let's make it the last question, lady over there, please. Economic Times. I'd like to refer to the electrical member who got infected. Is it a case with any known source of infection or no known source of infection? And what subvariant, what strain did he come down with? And also the Canadian girl, a female student, what school did she go to, the 15-year-old? How can you be so certain that this is an imported case and not a local case? Is it a reflection of the imported cases having longer incubation period? Do you think that the quarantine period should be longer? And also the hot pot footy, you mentioned the ventilation situation. There are no problems. Does it mean that even with good ventilation, it cannot guard against any outbreak? Now, for the 108 patrons, have they all undergone any testing? Are we witnessing the reinfection of BA.4.5 now? And for the BA .2, .12, .1 cases, where do they live? Thank you for your question. I'm not going to comment on individual cases here. Generally speaking, if there are cases that involve BA.4 or BA.5, all these sublineages, we will be reporting the location. But for other cases, we don't normally do that. Now, for the second question about the 15-year-old female student, we believe that this is an imported case because for BA.4, BA.5, the number in the community is on the low side. Now, for this particular case, she came back to Hong Kong from Canada. She was done with her quarantine in hotel on day 9. The CT value was 22-23, and it is likely that she got infected in Canada. It was an imported case. Of course, we cannot rule out the possibility of her being infected in the quarantine hotel. Now, this is under investigation. And during the quarantine period, we have to ascertain whether there are other BA4, BA5 cases in the hotel on the same floor. Now, the investigation is still going on. Epidemiologically, it is more likely that she caught it overseas, and it is an imported case. Upon arrival in Hong Kong, she was in quarantine. Upon the end of the quarantine, she visited a relative for dinner, and the relative also caught a BA.4.5, and the source probably was from this girl. Of course, we have to conduct genome sequencing to ascertain whether it matches with the prevalent strain in Canada. For hot pot footy, the EMSD has inspected the place, the ventilation, the air change per hour is about 7, and this is measuring up to the requirements. As to why there is still an outbreak, I think it is likely that the strain is BA4, BA5, and there is evidence to show that it is more transmissible than other Omicron subvariants. And this is the very first time that we have identified this strain in transmission in a food establishment. Now, for this particular case, the testing done was an RAT test, and it was not backed up by PCR test. And now there is a cluster, and they tested positive. It is likely that they got infected with BA4, BA5, and we will continue with the investigation. If this proves to be BA4, BA5, in March, we didn't have that kind of strain. It is likely that this may be a reinfection. That's where we end the press conference. Thank you all very much.
其實啲地址
Well, the address is scattered all of Hong Kong because of the sheer number. I didn't read them all out. For other addresses, they will be subject to CTN. And we have Sha Tin Tai Po, Kowloon Yaoi Estate, Tuen Mun Tai Hing Estate, Oi Man Estate, Yuen Long, Sha Tin Yut Ming Estate, and so on. That's it for today. Thank you all very much.